So we'll discuss on stroke. So let us see first what is a stroke. A stroke, it is also known as a cerebrovascular accident or the brain attack. It is a sudden impairment of cerebral circulation in one or more of the blood vessels. So there are many blood vessels inside our brain. So when one or more of the blood vessels inside our brain has an impairment, then it is known as a cerebrovascular accident or stroke. A stroke interrupts or diminishes oxygen supply and commonly causes serious damage or necrosis in the brain tissues. So here in the stroke, what will happen? It will interrupt due to the impairment in the circulation due to any etiological factor. The heart blood vessels inside the brain will be will be diminished of the oxygen supply. Okay, oxygen supply the brain will not get due to the stroke, and it will cause what? It will cause the necrosis and serious damage to the brain tissues. The brain tissues may be dead or cause even serious problems. So the sooner the circulation returns to normal after a stroke, the better the chances are for complete recovery. That means if the person has stroke and the circulation is returned to its normal, the sooner the circulation is returning, the better will be the chances of recovery. The later the circulation returns, then the worse, then the chances for complete recovery will not be there. So in the etiopathogenesis, a stroke typically results from one of these three causes. That means thrombosis, embolism, or hemorrhage. Thrombosis, it is the due to the thrombosis of the cerebral artery. So in the cerebral arteries supplying the brain or the intracranial vessels, the thrombosis, that means the blood clots, large blood clots might occlude the arteries inside the brain. Then it will cause the obstruction, and at last it will lead to the deprivation of the oxygen supply in that part of the brain. Then next is the embolism. Okay, so due to any embolism, embolism which arise from other parts of the body like the heart, aorta, or the common carotid artery, the embolism might come from these structures like the carotid artery, from the aorta, or from the heart, in the form of plaque, ear, or fat, whatever the embolism in any form it may come and reach a part of the brain, then it will occlude and deprive the area of the oxygen supply. Then last is third one is the hemorrhage from the intracranial artery or vein. So when there is any hemorrhage from in any of the intracranial artery or vein, hemorrhage may occur from like hypertension. Okay, then ruptured aneurysm. In case of hypertension, what happens is that there will be more pressure inside the blood vessels, and then it will rupture, or it can cause the damage to the blood vessels inside the brain. Then ruptured aneurysm. Aneurysm means weakness due to the weakness in the artery. Due to the weakness in the artery walls, there will be enlargement in the artery, and lastly it will rupture. Then due to that also, it might be the area of the brain might be hemorrhage might occur. Then due to any arteriovenous malformation means any defect in the arteries and veins which will be present from the birth itself. Okay, so due to these arteriovenous malformations, it might cause a hemorrhage, or due to any trauma, injury, or septic embolism. Septic embolism means embolism with the presence of harmful infectious bacteria or virus. Okay, so from these conditions the hemorrhage might occur, and due to that hemorrhage, stroke might occur. So these are the three causes for the under. Then let's see the risk factors or the predisposing factors. Risk factors are person with hypertension, person with family history of stroke, person with history of transient ischemic attacks. Transient ischemic attacks is similar to the stroke. symptoms similar to the symptoms of stroke, but it will occur for a few minutes. Okay, then in the then people who are having the cardiac disease like arrhythmia, coronary artery disease, acute myocardial infarction, and valvular diseases. Then people with diabetes are at risk. People with familiar hyperlipidemia, high levels of lipid in the blood, and then people who are having the habit of cigarette smoking, then habit of increased alcohol intake, obesity, sedentary lifestyle, and use of oral contraceptives. So all these are the predisposing or the risk factors. So in the risks also we have divided into high risks and the low risks. Under the high risks, it consists of the atrial fibrillation, rheumatic heart disease, artificial heart valves, then 6 sinus syndrome, sustained atrial flutter, recent myocardial infarction, congestive heart failure. Okay, then CABG. This CABG, it is a surgical, it is a procedure. This full form is coronary artery bypass grafting. Okay, coronary artery bypass surgery. This is done to remove any obstruction or plaques inside the coronary arteries. Then the low risk diseases are calcification of annulus of the mitral valve, patent foramen ovale, atrial septal aneurysm, left ventricular aneurysm, systemic hypoperfusion, hypoxemia, venous thrombosis due to locally increased venous pressure. So other than the general risk factors, so these are the categories of high risk and low risk persons who are having the next is the etiopathogenesis, pathophysiology. In the pathophysiology, first there will be thrombus formation due to the etiological causes. There will be thrombus formation. Then in the carotid artery or the intracerebral vessels, thrombus will pass to the carotid, will come to the carotid artery or intracerebral vessels. That is the blood vessels inside the brains. Then this thrombus will come to the carotid artery and it will obstruct the blood flow to the brain. So when there is blood flow is obstructed to that area of the brain, it will deprive the brain cell of oxygen and nutrients. If there is no blood flow, then oxygen and nutrients will not be able to reach that area. So the brain cells will be deprived of oxygen and nutrients. After that, it will cause the cerebral ischemic. So that area will be deprived of the blood supply. Then it will lead to the death of the brain cells. So when there is no blood supply, then it will lead to the death of the brain cells. Then it will cause a cerebral infarction. Then if there is cerebral infarction, then it will trigger the inflammatory response. When the inflammatory after the inflammatory response, it will increase ICP. It will increase the pressure inside the brain. Then it will result in the continuous cellular injury and disruption of metabolism. So this is about the pathogenesis. The next is a classification. It is classified into two main types, ischemic and hemorrhagic. In ischemic, blood supply to the part of the brain is decreased, leading to dysfunction and necrosis of the brain tissue in that area. So this ischemic stroke is caused due to the four main reasons. It is thrombosis, embolism, systemic hypoperfusion, and venous thrombosis. So we all know thrombosis is obstruction of the blood vessels by the blood clot. Embolism, obstruction due to the embolus from elsewhere in the body. Then systemic hypoperfusion, that means a general decrease in the blood supply. For example, in shock, there will be general increase in blood supply. This is known as a systemic hypoperfusion. Systemic means all over the body. Then a venous thrombosis, which is occurring inside the veins, is known as this venous thrombosis. So these are the main four reasons for the cause of the ischemic stroke. Then next is the hemorrhagic stroke. Hemorrhagic stroke is bleeding directly into the brain tissues, forming gradually enlarged hematoma. So when bleeding occurs inside the brain tissues, then it will cause the hematoma. So this is known as the hemorrhagic stroke. Then next is the common causes of the hemorrhagic stroke. The common causes of the hemorrhagic stroke are hypertension, trauma, if the person having bleeding disorders, then amyloid angiopathy. In this amyloid angiopathy, what will happen is that amyloid means this is a protein. Okay, it will this amyloid will get built up inside the arteries in the brain, and it will cause the obstruction. So this is known as amyloid angiopathy. Then illicit drug use, like use of amphetamines or cocaine. Then vascular malformations, like arteriovenous malformations. Due to this common cause, the hematoma enlarges until the pressure from the surrounding tissue limits its growth, or until it decompresses by emptying into the ventricular system, CSF, or the pia surface. So after the hemorrhage, hematoma will be formed. Okay, after hemorrhage occurs, the blood around the hemorrhage will form the hematoma. So that hematoma will has its doesn't have limits, but it will limit its growth when it will limit its growth when there is enough pressure, when the brain cannot take enough pressure from the hematoma. It will continue its growth until the brain can take the pressure. Then after that, or it may decompress by emptying into the ventricle. So it may go into the ventricular system, or it may go into the CSF through the or the pia surface, pia mater. Okay, so then clinical manifestation of stroke, they are divided into according to the area involved, and general symptoms are also there. The general symptoms we can remember are the unilateral limb weakness. That means one side of the limb will be weakness will be there. Okay, weakness will be there on one side of the body. Then speech difficulties will be there, numbness on one side will be there, then vision disturbances will be there, dizziness, anxiety, then altered level of consciousness. These are the general symptoms. So now let's see what are the clinical features which are according to the area of the affected region. So when it affects the middle cerebral artery, it will cause aphasia, dysphagia, visual field deficits, hemiparesis of the affected site. So they will be having the difficulty in speech and language. Then hemiparesis, that means one side of the body will be affected. Then if this in the carotid artery, then there will be weakness, paralysis, numbness, sensory changes, vision disturbances, altered level of consciousness, bruits, headache, aphasia. So like this, you just go through all of these areas, like vertebrovascular artery, if this in the anterior cerebral artery, if this in posterior cerebral arteries, what are the signs and symptoms, you should all by heart. Okay, then next are the pathophysiological changes in the brain when the stroke occurs. Okay, they will be affected. First one, the affected tissue will become softened and swollen. Okay, the affected tissue inside the brain will become softened and swollen. Then loss of definition between the gray and the white matter will be there. Then edema around the infarct resulting in local mass effect. Then histology shows infiltration by macrophages, which are filled with lipid products of the myelin breakdown. So affected area will be softened and swollen. There will be edema. This will be showing in the MRI, the mass effect. Okay, then there will be loss of definition between the gray and the white matter. Then in the histology, there will be infiltration of macrophages. Due to the inflammatory process, there will be infiltration of the macrophages. Then reactive astrocytes and proliferating capillaries are often present at the edge of the infarct. So at the edge of the infarct, there will be astrocytes will be there and capillaries will be present. Then dead tissues is phagocytosed to leave a fluid-filled cystic cavity with a gliotic wall. So there will be a fluid-filled cystic cavity formed by the dead tissues which are phagocytosed. Okay, so these are the pathological changes. Then complications are, there will be unstable blood pressure, cerebral edema will be there, fluid imbalances will be there, sensory impairment will be there, infections like pneumonia can occur, altered loss of consciousness, then aspiration, contractures, pulmonary embolism, and even death. Then next is the diagnostic measures. In the diagnostic measures, we can do the CT scan, MRI, cerebral angiography, carotid duplex scan, PET scan, echocardiography, EEG. EEG means electroencephalography. First, in the CT scan, we can identify if the stroke is ischemic, so we can identify within the first 72 hours of the symptom onset. Then hemorrhagic, if it is hemorrhagic stroke, then we can identify immediately in the CT scan. So when the person first comes with the signs and symptoms, CT scan can be done immediately. If it is hemorrhagic stroke, then we can identify immediately in the CT scan. Then within 72 hours, the CT scan can be repeated to see whether there is the ischemic stroke or not. Then in the MRI, magnetic resonance imaging, it will help in identifying the area of ischemia or infarction and cerebral swelling. Okay. Then next is a cerebral angiography. This will reveal any disruption or displacement of the cerebral circulation by occlusions by any thrombus or emboli or the hemorrhage. Then next is a carotid duplex scan. Carotid duplex scan will help in identifying the degree of stenosis. Then PET scan can be done. It will help in identifying the areas of altered metabolism surrounding the lesions. Okay. Then next is echocardiography. Echocardiography, it will help in identifying the cardiac disorders which are responsible for atrial thrombus formation, or in case of the thrombotic stroke. Then EEG will identify so before the treatment, we should first assess the pre-hospital assessment of stroke. We should first know the pre-hospital assessment of stroke, whether how to identify the stroke. So in the pre-hospital assessment of stroke, it is pronounced as FAST, fast. Okay, fast. There is different meaning for this. FAST. F means we should look at the face. For A we should look at the arm. S means for speech, and T is for time. So in the F, first we should look in the face to see if there is drooping or loss of muscle tone in the face. So usually we will see drooping on one side of the face. Then arm, we should ask the patient to close your eyes and hold out the arm straight for 30 seconds. Okay, if the patient have stroke, then we might see one arm tending to slowly move down. Then in the speech, we should listen if we can hear any slurring speech. The person speech will be slurred. When we ask any questions, he will not be able to answer properly. Then last is the time. There is time to call the ambulance. If all these criteria occurs, then we should call the ambulance. Then next is a treatment for the medications we can give for the ischemic stroke are the antiplatelet medications, anticoagulant, tissue plasminogen activators, statins, antihypertensives. For hemorrhagic also we can give the antihypertensives, diuretics, and according to the area and the size of the area which is involved, we can also do surgery also. So these are all about the management. So these are all about the stroke.